Good morning. We will now begin today's session. My name is Emily McCluskey, and our topic today is the monthly service delivery report. Before we start, I will have the co-hosts introduce themselves. Teresa, if you'd like to begin.
Hi, I am Teresa Young. I work in data management training and technical assistance, and I will be assisting Emily today with the questions as well as demonstrating data entry. Thank you. Emily, I don't think that Paula has joined us yet.
Okay. I was just going to ask if she was on.
Yes.
Let's see. All right. Well, I will get started, and then if she joins in. Okay. For past trainings, links to recordings of past OASAS applications trainings can be found on the OASAS applications home tab. You do not need to log in to view these recordings. User guides for every client data system transaction can also be found on the home tab. Each user guide has screenshots walking the user through entering the transaction. Each guide includes narratives, screenshots, and prompts indicated where the information is found on the screens. The agenda for today's training, we will go over the overview of the monthly service delivery reports, and then each individual MSD, the Part 822, patient days, Part 820, crisis program MSDs. Some housekeeping notes. Questions can be placed in the chat and will be addressed at the end of each section. Please ensure that questions aren't messaged privately to the presenter or host. Messages to everyone allows other co-hosts to support the chat box. And this training will be recorded and will be posted. For the monthly service delivery report overview. Monthly service delivery reports are due by the 10th of the month. They demonstrate the workload of the program, collect information regarding the program staffing and vacancies, collect information regarding supervision sessions, collect information regarding employment activities, such as the program is approved to submit this data. For Part 822 programs, it collects information regarding ambulatory patient group services delivered by the program. For Part 822 programs, it is the source of information used by OASAS to calculate units of service. Part 822, outpatient MSDs. Census and waiting list information, lines V1 to V5 are calculated based on the client data system entries. If CDS transactions are entered after the MSD is completed, the system will update based on the newly entered information. Treatment visits. Lines V6 to V10 enter the total number of visits for the month and the appropriate time duration. Visit refers to a threshold visit, not a service. An individual may come to the clinic to attend a group, 60 minutes, a peer service, 15 minutes, and meet with a doctor for 30 minutes. The durations would be added together for a total of 105 minutes, and one would be entered in V8, 60 to 119 minutes. V11 is a calculated item based on the number of transactions entered in the continuing care system. Lines V6 to V11 and line V17 are used to calculate the units of service. Admission assessments completed, line V12. This is the number of admission decisions, not visits, made by the program during the month based on the clinical assessment process. Primary patients are individuals admitted to address their own SUD issues. Significant others are individuals admitted to address the impact of someone else's SUD issues on their life experience. Other persons are individuals that were assessed but were not admitted. There is a business rule in our system that states the total admission assessments completed can't be greater than the number of admission assessment visits reported in lines V13A to V13C. Admission assessment visits. An assessment visit is a visit conducted by a clinical team member with the purpose of gathering information needed to make an admission decision. Enter a count of the visits for each duration and by each staff grouping. This information is also included in calculating units of service. Staffing definitions. Primary counselor is a direct care staff member who is assigned a caseload and is responsible for managing the treatment of those individuals. Non-primary counselor is a direct care member who is not assigned a caseload or has a caseload but is not responsible for the primary treatment of those clients. Other direct care staff is other clinical treatment staff not defined as above. This group may include interns and volunteers. Counseling sessions. This is a count of the individual and group sessions facilitated by the program staff. It is not the number of individuals who attended the sessions. Individual sessions are broken down by duration. Reported for each staff grouping. This information is used to understand the workload of direct care staff. Other ambulatory patient group services. This is a count of services provided post-admission with the exception of V16 screening, brief intervention, referral to treatment. If a service is documented in this section, it is still counted in treatment visits. Line V6 to 10 with the exception of V17, medication administration and observation. Do not add those visits into the data entered in lines V6 to 10. The instructions include links to more detailed information defining services for each line. Staffing resources. This item helps OASAS understand the workload of the program. FTE is a full-time equivalent. It is not a count of the number of staff members, but of the full-time equivalents. If a full work week is 40 hours and there are 2 staff members, each working 20 hours each, this is 1 FTE. If a staff member is technically on payroll but not working, for example, on medical leave for the month, document as a vacancy. Clinical supervision sessions. A count of group and individual for direct care staff that took place during the month. Employment vocational status. If the program provides OASAS-funded vocational services, the data is entered in the section of the MSD. And I will pass on to Teresa now for the demonstration.
If Teresa can unmute herself. First, I'm going to stop because there were some questions in the chat. So let me go back to that before we move on to entering data. I think the first question was, what is a threshold visit? Which means basically the client crosses over the threshold into your program. And we count 1 regardless of how many services they receive during that day. So you would, I think Emily had an example of someone who received multiple services during the day. They went to a group as well as meeting with their individual clinician, and that added up to a duration which you would then put 1 in the appropriate duration. You wouldn't put 1 for the individual session and 1 for the group. So that is a threshold visit. The next question is, are you going to discuss CCBHC OMH-hosted site reporting today? We're still learning what is required since becoming an OMH host site. Basically, the reporting requirements are the same for CCBHC as they are for a Part 822 clinic. I know there have been some questions historically about how do we document staffing, since staff may not be just dedicated to SUD services. And I'm not sure how CCBHC has responded to that. We do have Paula online today. Paula, do you know what the response has been to individuals about their MSD reporting for especially staffing for CCBHCs?
That's actually a really good question that I can bring back to the adult treatment unit here. They would be the ones that can better answer that than myself.
Okay. And Paula, is there also a CCBHC mailbox?
Yes, give me 1 second. I can actually put that into the chat.
That would be great. I also think in addition to Paula bringing that back to her team, you may want to put that question to the CCBHC mailbox. I know when I've been speaking to some other staff who work with Paula, they've mentioned possibly having that discussion as a larger discussion with OMH, and I believe there's possibly regular work groups for CCBHC, and I think they were talking about having that discussion there also.
Yes, I can also put a link to the Pick'em mailbox, which is a great area to send some questions as well.
Sure, that would be helpful. The next question is, would I be able to get access to these slides after the presentation? Historically, we have not posted the slides, but that is a request that I can again forward to see if we can post the slides. But as Emily mentioned, the presentation itself, which will include the slides, will be available on the Home tab under Online Tutorials. So once the recording is finished, it will be posted here, and you'll have access to it to view as you would like to at that point. But I will bring the question back about posting slides. I think Emily also pointed out we have user guides, including how to complete the MSDs, and we do break them down by different program types here. And all of our forms or instructions are here. The MSD forms and instructions are down towards the bottom. And you find them right above the other documentation of the batch in case providers would like to submit their CDS transactions via batch. That's located at the very bottom. MSD is above that. And over here, we'll just point out that if anyone needs access at your program, they would need to complete the OASAS External Access Request form, and that will need to be signed by the OASAS External Access individual within your agency. And your agency or provider can identify 2 people in that role, and that identification is done through the PDS contacts. So if you need to update that, that is where it would be. So now I'm going to go, oh, Paula did just post the mailbox, so thank you, Paula. I'm going to go into Applications and to the Monthly Service Delivery tab. And then to Monthly Service Report. It'll populate with your provider information here. You would then enter your program number. If you don't know your program number, you could click on the flashlight and then search by, it will populate, it should populate a list. Oh, I already have 28 in here, so it won't give the whole list. But if I didn't have 28 in there, it will list all the programs under my provider. And I could select from there, but we do have 28 here. You can put in your operational status. It is not required. So you can just leave this drop-down blank. But you can also select something if you would like to. Find will take me to this screen. Since I want to update the MSD, I will click List of Reports, and it will populate the entire list for this program, the whole history. I left last month's on hold. I'm unable to complete this month for January until I complete December's. So in order to move on to January, I have to open December's by selecting the circle next to it, clicking Update. And I already had entered some data into December. So if you're in a position where you have some information but not all of it, you can enter some of the information And you would come down here, select hold instead of complete, and then just click save, and that will save everything you've entered, and you can come back to it at a later time. When you think all the information is entered, you would change to complete, click save, and then you should see this message saying it was saved successfully. This will then let me go on to the next one that's due. And I can either go back to the screen and select the way that I had, or just click the arrows that I see here. As Emily mentioned, this section populates based on your CDS transactions. So those are your admissions, your discharges, your transfers that have been entered during this month, actually for this month. So we will see those numbers here. Primary patients or individuals admitted to address their own SUD issues, significant others addressing the impact of someone else's SUD on their life. And here we come down to the treatment visits, and as we mentioned, they are threshold visits. You just put in the total number for the month. So I will put in some data here. If I see an asterisk, it means it's a required item. I can't save this MSD unless I put something in that box, even if it's 0. So I'll put 0 for 180 or higher. As Emily mentioned, less than 30 minutes excludes med admin visits. So if someone came in just for the med admin service, did nothing else for that day, you would not document anything here because you're going to document down below in the APG section. Continuing care visits populate based on the number of visits that were entered into that data system. So it's not something you'll be entering here. Assessments completed. This is the number of basically admission decisions that you made in this program during the month. So we see that we had 8 people come into the program, so I should have at least 8 primary patients here. Significant others, we didn't admit any significant others, so I'm going to put 0. Other persons, people who participated in the assessment process but for some reason weren't admitted, so we'll put 2. Yep. Click over here for 2. And now this is the visits that sort of support these decisions. So 2, and you put them down by the staffing group, whatever the appropriate staffing is. 8, 2. And now we come down to individual counseling sessions. This is the number of sessions delivered by your staff, broken down by duration and type of staff. So primary, we're going to say normative. And as mentioned previously, group counseling is the number of sessions delivered, not the number of people that attended. So we will say and because there's an asterisk, I need to put something in there. The number of outpatient rehab sessions delivered during the month, and we have partial or full. And we didn't do any OPR sessions this month. Expert sessions. And these are the only pre-admission services outside of assessment that is documented up here, that is documented on the MSD. Everything else is post-admission. We'll say we did 2. Med admin, this is the one that is not counted up in the treatment section of B6 through 10. So 50, and then med teen. Everything else here is counted in V 6 through 10. No iOS services. Do that. Staffing information. As mentioned, this is FTEs, full-time equivalents. This is not the number of people that you have on staff. As the example said, there may be 2 people sharing an FTE if they're both working part-time. So based on whatever your standard work week is, you would document the number of individuals you have in each role. And we have no vacancies, so we'll just put 0. Individual clinical sessions, we will do at least 1 per staff member during the month, and then we had 2 group sessions a week. I will then choose my status here, complete, save. If I entered everything successfully, I will then get this message. If I don't see the completed successfully message, it means there's an error and I need to go back and fix that. The question in the chat box, does your bottom section need to equal the top section? So bottom section, am I to understand you're talking about this other APG services section? If so, no. This could be very different, and it should be very different, especially because here you have the number of groups. So I said we offered the entire month 90 groups for the month. If you have 10 people attending each group, you're going to have 900 units of service. So I would see 90 here, but in the 60 to 119, because a group should be at least 60 minutes, I would put 90 here. I'm sorry, 900 here, even though it's just 90 here. Those people may also have attended a med management session while they were in the group. So that would be here, but it's just going to be covered in the 60 to 119, so there wouldn't be anything else up here. I'm responding to the question that said I was told the top section should equal the bottom plus the middle. It's really not possible for that to happen. As I mentioned, especially if you're doing groups. So I would say that group, unless you're not doing any groups, it may be possible. But again, you would then also have to not be providing any med admin sessions, because that will be here, but you won't be documenting that up here in the 17. So it's really almost impossible for it to equal out. It would be extremely difficult. So that is it for demonstrating the data entry in a Part 822 MSD. I don't see any more chat questions, so Emily, we will go back to you for the next section.
All right. Program supporting patient days, not including crisis, or Part 820 residential MSD. Census, waiting list, and patient days. This is calculated by the system based on the CDS transactions entered during the month. The system updates these calculations if CDS transactions are entered after the MSD is completed. Patient days are the basis of the unit of service calculation for these programs. Staffing resources. This item helps OASAS understand the workload of the program. FTE is a full-time equivalent. It is not a count of the number of staff members, but of the full-time equivalents. If a full work week is 40 hours and there are 2 staff members, each working 20 hours each, this is 1 FTE. If a staff member is technically on payroll but not working, for example, on medical leave for the month, this should be documented as a vacancy. Children and residents. calculated by the system based on the CDS transactions entered during the month. The system updates these calculations if CDS transactions are entered after the MSD has been completed. Assessments completed. This is a count of the admission decisions made during the month based on a clinical assessment. Primary patient is an individual admitted to the program. Other persons is anyone who is assessed but not admitted to the program. Counseling sessions. This is the number of sessions facilitated by staff during the month, not the number of individuals that attend the sessions. This is a demonstration of workload. Clinical supervision sessions. The number of individual and group clinical supervision sessions that took place during the month. Employment vocational status. If a program provides OASAS-funded vocational services, the data would be entered in this section below. And I'll pass on to Teresa then for the next demonstration.
Get the chat box because it keeps disappearing on me. Okay. So again, we're back to the screen where we will select a program. And choose 18. And we're working on a patient days, which is an inpatient program or a residential program that is not a Part 820. It defaults to the most recent MSD, which was January. And clicking update, it takes me to the screen. Again, we see that CDS information populating, and we see the patient days, which is the unit of service for a bedded program, and that'll populate there. So if you see an issue with your patient days, you want to be looking at your CDS entries, not your MSDs. And we go to FTEs, and again, required information because we see that asterisk. So I'm going to say that we have 3 FTEs, and they are 2 primary counselors, 1 other, and we have, again, no vacancies for the month. Assessments completed. Here we see just the assessments completed. We don't see visits. And this is how many decisions did we make? Primary clients being the individuals that we would admit. So we have 5 came into our program during this month. Other persons are people that we assessed but for some reason did not admit. So we'll say 2. Number of individual counseling sessions, and here we say they have to be 30 minutes or longer. We will say group sessions offered. Again, the number of sessions offered, not the number of people that attended. So we'll say. And family counseling sessions. They can be by any direct care staff, 30 minutes or longer. So we'll say we did 5 during the month. And we again see clinical supervision, so just a count of at least 30 minutes in duration. And then again the group. And the status. I'm actually going to take this out just so that we can see, hopefully we get an error message. And we do. The report has errors, and I can't mark it as complete. And then it will show me where my error is, and if I click on that label, it will actually take me down here, and I see the red note here, so I know what to complete. And then it takes the data. We have one question. I did not fully understand the section on group counseling. Could you clarify how we record the total number of groups conducted during the month? And I assume this is on the patient days MSD. And if I'm incorrect, please just put that in the chat box. But that's what I'm going to assume at this point. So this is just a count of the group sessions that were provided at this residence by the staff that were documented up in staffing resources. So you would just literally go through and count the number of groups that you offered. This was a rather intensive group with 40 count, but they have to be 30 minutes in duration, and your primary counselors. Again, as Emily mentioned during the previous section, the MSD is a measurement of the effort and workload of your staff, and at this point they're measuring the workload of the primary counselors in direct care activities. So whatever groups you may be offering at your residence that are at least 30 minutes and offered by primary counselors that you documented in this section, you would just put that count in that box. If something's still unclear, just please pop the question into the chat box and I will try to address it. Okay. Emily, if you want to continue on with the presentation.
Part 820 Residential Program MSD. Census waiting list and patient days information. This information is calculated based on the program CDS transaction entered during the month. Patient days is the unit of service for Part 820 residential programs. Staffing resources. The approved staffing plan is pre-populated based on the program application and/or budget. End of month vacancy is compared to the staffing plan. If the program elects to staff above the approved staffing plan for any role and is in the process of hiring, the program would still enter 0 for EOM if all approved positions in that role were filled. Children and residents. This information will pre-populate based on CDS transactions that are entered during the month. Admission assessments completed. The number of admission decisions made based on clinical assessments. Clinical supervision sessions. This is the number of group and individual clinical sessions that took place during the month. Employment educational status. If a program provides OASAS-funded vocational services, the data is reported in this section. And back to Teresa.
And this time I have myself unmuted, but I still need to find the chat box. Okay, so we're back at the screen where we're going to choose a program. And we will choose 19 this time. List of reports. And this is our 820 MSD. Again, we see the CDS transactions here with the number of clients that were in our program at the beginning of the month, broken down by element of care with the total at the end. We then see admissions, discharges presented in the same way by element of care. If we had a waiting list and we were entering that data into the OASAS CDS system, we would see that number populate here under the total row. And again, we see patient days, this time broken down by element of care and the total under all clients. So if you have an issue with your patient days, again, that goes back to your CDS transactions, not your MSD. We go down to staffing plan. If this were a certified 820 program certification, the Bureau of Certification would have entered your approved staffing plan, and we would see data populated in this column. And then I would be going through and looking and saying, let's see, we have one physician of the approved staffing plan. We have one physician currently working, so I would put 0. We're not trying to hire. Same with psychiatrist, RN. Maybe in the example that Emily gave, we're hiring above our staffing plan for KSAC. So if I'm approved for 3 KSACs, and I have 3 on staff, but I decided 4 would be better to fit our needs, and I'm hiring for 1 KSAC, I would still document 0 because that is above our approved staffing plan. If I was approved for 1 KSAC-T and I had none on staff currently, I would then put 1 because we are actively looking to hire that individual. Again, children in residence populates from the CDS, and whether or not you're checking in children via that data system, and that is for programs that are approved, have approved children's beds on their operating certificate. Admission assessments completed. Again, a count of the admission decisions that you made. This would include both people that you admitted as well as others that for some reason participated in the assessment process but elected not to be in your program or you felt weren't appropriate for this specific program. So I'm just 5. And we go back to clinical sessions, supervision sessions, and we'll do 4. And this program is not approved for vocational, so we do not see that data here. I pick the report status I would like, save, and I get the save message. I'm going to go back up to the questions. Are we using the same MSD reporting forms for CCBHC SUD program? Yes. If you're reporting for a CCBHC SUD program, you're going to be using the Part 822 MSD, which was the first one that we demonstrated and was presented in this training. So you use the same forms as you would for admissions and discharges that you would for an 822, and you use the same MSD as a Part 822 program would. I'm going to think there are no other questions on the 820 MSD. So Emily, if you want to go on, I believe crisis may be up next.
All right, so crisis services MSDs. Census information, primary service activity, and medically managed detoxification. All information in these sections, with the exception of visits, will populate based on the CDS transactions that were entered during the month. If CDS transactions are entered after the MSD is completed, this section will update. Visits are used by ambulatory programs. Only 1 visit per day per client can be reported. Staffing resources. This item helps OASAS understand the workload of the program. FTE is a full-time equivalent. It is not a count of the number of staff members, but of the full-time equivalents. If a full work week is 40 hours and there are 2 staff members, each working 20 hours each, this is 1 FTE. If a staff member is technically on payroll but not working, for example on medical leave for the month, document as a vacancy. And I'll pass that off to Teresa.
Okay. So we're back at the program screen, and I am going to go to my crisis program. Open that MSD. And literally in the crisis program, the only thing that we're filling in is the staffing information. As with all other programs, the census will populate from the CDS transactions you're entering, so the PAS46. We're going to see patient days there again. From your PAS46, it's calculating that information. Ambulatory visits would be a little different. If you have an outpatient crisis program, that is, you'd see the visits instead of the days there. And then again, the beds populate from the information entered on the 46. So we are just entering staff. So we will say we had, actually I'm going to say 3. So we had 2 primary counselor FTEs, and we had 1 other direct care FTE, which may be some medical staff. I had a vacancy in my medical staff this month. I switch to complete, save, and that is the completion of the crisis program. Let's see. We do have a question in the chat box. How many days do I have after the due date to submit the monthly service delivery report? The MSD for all program types is due by the 10th of the month. So they become available on the 1st of the month, and you have the 10 days to complete before they're considered delinquent. We then, every month, send out a notice to programs that have exceeded that 10-day limit, just as a reminder to please go in and complete that MSD. So if you go past the 10th of the month, you may see an email from us asking you to do that. Okay, Emily, back to you.
Okay. Available reports. Reports available on the MSD tab. There's the MSD summary report. This is useful for seeing the calculations used for units of service, especially for Part 822 programs. The program history by provider is a convenient way to see a snapshot of aggregate data for a specific time period. MSD Patient Days Report is for embedded programs. This is the best report for resolving issues related to patient days or units of service for a program. All right. Is there any questions in the chat box at all, Teresa? I cannot see them.
Okay, let me see if I can see any. Not so far.
And then any questions, if there's any questions after regarding OASAS application data entry, you can contact data management at 518-457-9555 or at our email at data.mgmt@oasas.ny.gov. Questions regarding clinical guidance can go to Pick'em, and any password and login issues can go to the help desk and the information seen on the screen. And I think I saw a question come up, maybe?
There is a question asking how do we define direct care staff. So we do have those definitions in the instructions that were found on the Home tab that we highlighted earlier. The direct care staff is any qualified health professional or clinical treatment staff providing direct clinical services, treatment services. They could be counselors, social workers, psychologists, psychiatrists, physicians, nurse practitioners, vocational counselors, rehab counselors, recreational specialists, administrative staff, support staff, overnight staff that are overnight aides are not direct care staff. And there's a question, okay, so I can show the instructions. Just give me a minute to share my screen. There's a question asking if I could share the screen, so I will do that. So we should hopefully be seeing my screen. And back on the Home tab, and we scroll down, and there's a section, Monthly Service Delivery Reports, Forms, and Instructions. So if I open, let's see, I'll do Part 822. That's the Part 822 instructions, and we just break them down in the same order that you will see the form, with definitions, treatment visits, counseling sessions. It will give a brief description of individual sessions. And I'm sorry about the scrolling. I wish I had a page icon at the time, but I don't. Here we also see the APG section. We have some links out to files that will help crosswalk these numbers to the services that we're looking for to be reported. And down here is the definition of direct care staff. We define treatment services, a primary counselor being someone who is assigned a caseload, if you're looking for that sort of difference between primary and non-primary counselor. Let me go back to the questions. Yes, we don't add any other groups by counselor's aid, only primary counselors. Yes, for the residential, it's primary counselors. Okay. All right. How often should PAS 126 be completed for CC clients so that the data is calculated for CC being continuing care on the PAS48? So continuing care is handled by PICM. My understanding is that the data is entered every time someone participates in a continuing care session. So you should be entering that data every time there's a continuing care session, and then it will populate into the 48. Paula, am I incorrect in that, or is that accurate?
Nope, that's accurate.
Okay. If your facility has 4.5 staff, do we round down or to 4 when counting? Do we round down to 4 when counting staff? No, you can enter 4.5. That would be fine. You can, if you have 4 1/4, it's 4.25. Whatever is an accurate FTE count for your program. So whatever percentage is accurate, that's what you should be entering. You don't need to round up or down. Okay. If questions come up after we finish, of course, Emily had that information. Emily, if you want to put your screen back up that has the email addresses in case people need that. There we go. Oh, Emily, there we go. Thank you. So yes, if you have any other questions that come up after we log off, please feel free to direct them to the appropriate mailbox, and we'll get back to you as soon as possible. Thank you, everyone, for joining us today. I appreciate it. Have a great afternoon.